As the world commemorated World Patient Safety Day 2025, the West African Postgraduate College of Pharmacists (WAPCP) raised alarm over rising unsafe healthcare practices, revealing that 1 in 10 patients globally is harmed during care, leading to over 3 million preventable deaths annually. At a press briefing in Abuja, WAPCP FCT Zonal Coordinator Dr. Abubakar Danraka highlighted the theme Safe Care for Every Newborn and Every Child, stressing that children and newborns remain highly vulnerable, with up to 97% of adverse events in neonatal care deemed preventable. Citing common systemic failures such as medication errors, hospital-acquired infections, and poor communication among healthcare workers, WAPCP urged urgent reforms including wider deployment of consultant pharmacists, government action on patient safety policies, and public education on patients' rights. The college also spotlighted efforts to combat antimicrobial resistance and called for stronger clinical standards and family involvement in care.
Our clarion call to action is for the Federal Ministry of Health and indeed all federal health institutions to, as a matter of urgency, act effectively in prioritizing patient safety in Nigeria, because the studies have shown how it impacts on patients' life and patients' well-being, as a means to reduce the occurrence of medication mistakes, enhance healthcare results, and eventually enhance the overall health and well-being of Nigerians. Also, we will not end this press briefing without calling on the Federal Competition and Consumer Protection Commission, FCCPC. They should step up advocacy and implementation of the Patient's Bill of Rights across the Federation, particularly in FCT, so that patients and all caregivers should know their rights and hold relevant stakeholders accountable within the healthcare sector. By prioritizing patient safety generally, and most especially child-centered safety, we can save lives and strengthen lifelong health outcomes. This year's campaign emphasizes for stronger clinical safety standards, better training for health professionals, improved welfare of health workers, and more effective systems for reporting, learning, and family engagement.